But I do want to move over to hear from Sergeant Payne. Invited Sergeant Payne from the Santa Barbara Police Department to share specifically about how the police is involved with behavioral health issues around people experiencing homelessness, because in many ways, with the staffing shortages, the police have become, in many ways, a first responder for a lot of these issues, and one of our primary behavioral health resources we have at this point. So I wanted to turn it over to Sergeant Payne.
Good morning, everyone. Can everybody see the PowerPoint? Yes, okay, good. Already been introduced, but the two units that I supervise specifically are the community action team, which is the officers that primarily are out on bicycles in the downtown, waterfront, and Milpas districts. And then also the co-response team, which again is specifically dedicated towards behavioral wellness and focuses on individuals experiencing crisis. So what I mean by that is typically individuals that are having thoughts of suicide, self-harm, or harm of others. So individuals that are in immediate need of assistance. Couple overview slides here first regarding the department as a whole. Stuff that I want to cover today is our department policy and philosophy. Talk a little bit about those two units more in depth, relevant training that officers receive while here at the police department and utilize during their day-to-day activities. Our current response model, our relative or some relevant statistics, which again, I'll go into that and how, again, statistics have their own shortcomings, and then some other kind of anecdotal evidence of what we see on the day-to-day operations, and then end with questions. So starting with the department philosophy is, again, amongst all of our community members, we want to ensure equitable service. Whether you're experiencing homelessness or whether you live on the Riviera, we intend on providing you with the same service across the board. We want to be procedurally just with everybody. And what I mean by that is giving individuals that we interact with a voice, their ability to speak about the interaction and give their inputs as much as we honestly can. We want to remain neutral, provide everybody with respect and trust. The best solution oriented is our ultimate goal. What that means is that we want to spend more time to produce a long-term solution to issues rather than trying to constantly use band-aids to solve problems and then have them reoccur again. We practice a multidisciplinary approach in that we work with tons of our community partners, whether they are nonprofit or county services. So lots of different folks, everybody at SB Act, all the housing associates that we work with as well. And then kind of the awareness of the mental health impacts that and how it has, or what it occurs in the city of Santa Barbara and the greater community. You know, we have a lot of overlap with individuals that travel through Santa Barbara and either primarily reside in Goleta or Carpinteria, but we tend to have interactions with those folks as well. A couple policy things just to kind of show what the Santa Barbara Police Department does is first and foremost, when it comes to helping people experiencing homelessness, is that we want to ensure that all of our personnel understands the needs and the rights of individuals that are experiencing homelessness. We want to address their needs and balance with the overall mission of the police department. And then in the next section there highlighted is we make it a point to inform all the officers that homelessness is not a crime. And members of the police department are not to use that solely as a basis for detention or law enforcement action. There has to be some other issue or experience that allows us to go through those contacts. And specifically with mental illness and mental impairment, it's in our policy that the contacting officer should provide an individual experiencing homelessness with contact information for mental health assistance as appropriate. So depending upon the individual and their level of cooperation will determine how far we're actually able to take that, whether it's either getting them to the hospital, driving them out to Be Well, or trying to set up an appointment through one of our other partners. So again, key points that we cover in the policy is that, you know, we as an agency recognize the impacts of mental health on our community and on the individuals that we come in contact with a day-to-day basis. We recognize that there's a need for a balanced approach. Being in law enforcement, you know, everybody thinks that, well, we either just arrest people or issue citations. And as law enforcement continues to develop and evolve, it's not really the case. And I'll have a couple of slides that points that out. We're much more of a holistic approach to providing for the needs of the community and security and safety of the community than just an enforcement attitude. And then obviously we made it such a point that to include that homelessness and mental health are not criminal issues. We're not trying to criminalize these issues, but as first responders, we tend to be the first ones on scene. And so sometimes it's hard for somebody experiencing either homelessness or a mental health crisis that we're there to help them and not necessarily there to try and arrest them or take some sort of a enforcement action. And it's very resource focused. Trying to develop the resources within the police department, such as the co-response unit, is an invaluable tool for us. Those are tools that we just didn't have before. And so we're trying to develop our own resources as well as utilizes the other resources in the community to provide assistance to those individuals. So how do we respond? There's basically two responses that we have. First and foremost, everybody's familiar with the patrol division. So looking at the left-hand slide or left-hand portion of the slide, patrol works 24 hours a day, 7 days a week, 365 days a year. There's never a day off for patrol. Their training is basically covered in the academy, as well as once they get out of the academy, we have a field training program, which consists of 3 6-week phases. So they have 18 weeks of additional training there, plus another month before they even start the field training program. We value the CIT training, and we're actually 100% in compliance for all of our patrol officers, which is, I think, a huge accomplishment for our agency, because a lot of agencies don't have the time or don't dedicate the resources to being 100% trained on the crisis intervention training. And then again, we have the ability to contact our internal and external resources for assistance, which we rely on greatly. In terms of our specialized response, we have the co-response unit. So right now, we currently have one co-response officer. We're looking for to get another one, but as described earlier with the staffing crisis, we're unable to get a second clinician from behavioral wellness because they're also experiencing their staffing crisis issues. And so we're unable to staff that. But right now, our co-response officer works Monday through Thursday from 8 o'clock in the morning till 6 in the evening. So they provide a lot of daytime assistance primarily at this point in time. Our goal is to try and have 7-day-a-week coverage. And then if we actually could get up to staffing as well as with Be Well, we would like to go to probably about like an 18 to 20 hour a day coverage would be optimal 7 days a week, but that would require 4 co-response officers and 4 clinicians, which at this time it's just not doable, especially with B-Well. We do have an officer. The chief is willing to commit to another officer if hopefully B-Well can have a little better luck with their staffing issues. And then secondly, we have the community action team, which is my team, the units on the bicycles, and they primarily make contact with individuals that are experiencing homelessness in their actual camps. The biggest thing that we do as a unit is work with our community partners. If it's not an issue of immediate need, such as the co-response unit or somebody experiencing crisis at that exact time, then we push towards getting them to other resources that we have available through them, either through SBAC, Good Sam, any of our other partners. CityNet is super helpful with us as well, getting folks to appointments and other issues that they may need to tend to. Our current response model is basically, a lot of it is data oriented. So we'll look at areas, crime stats, community concerns that come to us and focus our time on that. Actually, you know what? I apologize. I'm going to go back one slide. I forgot to say, for the community action team, we have, I have 4 officers that are full-time. We are 7 days a week. A pair of officers work Sunday through Wednesday. The other pair works Wednesday through Saturday, and currently we're day shift. So that's going to be 6:30 in the morning till 4:30 in the afternoon for coverage. Back to the response model. Besides the data oriented, we also have focused areas. So again, these are hot spots that we come up with based upon calls for service and based upon our observations. Most of the time is we will see individuals move into an area or see an encampment pop up that wasn't there before, and we'll try and address those individuals, have conversations with them, find out what their needs are, and try and direct them to the best resources that we have available. Again, I think I've kind of covered multidisciplinary to the extent that it needs to, but again, we're very partnership focused. And we also realize that law enforcement is not always the best option for individuals that are experiencing needs. Again, if it's not a criminal offense at the time, we want to try and link people up with the resources that they can use to help them through whatever that situation is. And hopefully having those resources, one, will free us up to be able to tend to other actual criminal matters within the community, but also reduce the stigmatism of that we're just there as law enforcement to write people tickets or take them to jail. And ultimately our goal is just to help everybody that we come in contact with, whatever their needs may be. So in order to try and highlight that, our agency has evolved from the traditional statistics of just looking at arrests and citations, and really changed our mission strategy. And we've broken it down into 4 blocks, as you can see. So in the upper left quadrant, we have reduce harm. This is your traditional law enforcement activities that you would think of: arrests, DUIs, traffic citations. But we do include Narcan deployment because again, we're now responding to more people that are overdosing, and by getting there first, we're able to help those individuals reverse the effects of the opiates and potentially save their lives. Moving to the upper right quadrant, this is more of what we're actually doing on the day-to-day basis that we didn't capture data-wise previously. This is engagement in the activities, community contacts, business contacts, government agency contacts, presentations such as today, parking citations, and our co-response deployment. Those are kind of the quality of life issues that are being addressed. And then going to the lower left, we have felt presence, which is foot patrols, bike patrols, premise checks, directed patrols, and focus areas. This is other means of getting out and being able to engage with the community, and then also do it in a manner that is kind of at the request of our community. The directed patrols and prem checks and focus areas primarily are driven by community response. And then lastly is service, which is our calls for service totals. CSI stands for crime scene investigations, our standard reports, and then follow-ups, investigations assigned, as well as co-response or mental health assist, and then the traffic collision reports. So this is specifically, this is CFS is calls for service outcomes. And this specifically looks at my unit only, the community action team. So for the last 6 months, from last November through May, on the left, you have on view calls for service. And I know that has a ton of numbers in there, but this is what that means is this is activity that was initiated by the officer. So they weren't dispatched to it. They were in an area, saw something that they needed to address, and addressed it, whatever it may be. Primarily, most of those contacts are related to criminal activity because it's on view. It's something that we see, so it gives us a reason to stop and typically detain somebody. And out of all of those calls, only 35% of those calls are being cleared with an arrest, a cite, or a misdemeanor cite. So some sort of enforcement action. So still 65% of our contacts where we see something are not resulting in any enforcement action. And then on the right, these are our calls for service. So these are typically calls that are given to us by dispatch. So they come through the community. Only 13% of those calls are resulting in arrests, citations, or misdemeanor citations. And I think that really highlights the fact that we're not trying to criminalize homelessness or people experiencing mental health crisis. And then out of the last, in the middle stat there, you have what we call our de-escalation flag. And this is a new piece of data that we recently started to collect. And what that means is we had 68 of those de-escalation flags in the last 6 months. And that means that we were able to use some other method to gain cooperation without having to use force on an individual that we that we had legal justification to use it if need be. So we're really trying to slow things down, use that crisis intervention training to communicate with individuals and come to a safe resolution for everybody that doesn't require the use of force. Here's kind of our calls for service heat maps, again, for the community action team. So you can see that we do have calls spread out throughout the bulk of Santa Barbara, but the beachfront, the downtown corridor, and the Milpas corridor are our main areas that experience the most number of calls for service. We have a few on the north end, not too many on the Mesa, not too many on the Riviera, but the bulk of our work is downtown and along the beachfront and Milpas. So looking at some of the calls related or homelessness calls for service, again, these are numbers, but I'll explain in a few minutes that these aren't necessarily the best numbers. But in terms of patrol, in the last 6 months, we're looking at about 19% recorded. And then in terms of the community action team, we're looking at about 33%. I think on the numbers as a whole, if we just look at them as percentage wise, they're probably reasonably accurate. There's going to be some calls missing, and I can explain that up here. So looking at data, we have issues, and the data is only as good as what you're able to capture. most of the calls, when we notate the involvement of different either types of people or call classifications, officers use what they call study flags, which is the next line down here. So we have a homelessness one, and we have mental health. We also have drug related, domestic violence related, alcohol related, and we have de-escalation. But out of all of those flags, we're only able to capture 2 on every call. And so if the officers are clearing on their computer, they're going to have their choice. Would it be mental health and homelessness? Would it be mental health and drug related? They can only pick 2 of them. And then we do prioritize the de-escalation flag. So if de-escalation should be one of those flags, that's to be put up first, only leaving the officer one other choice to enter. The other issue that we have is if you clear over the radio versus over MDC is the mobile data computer. With my officers on the bikes, they pretty much clear over the radio. So you have what we say and then what dispatchers put in. There's a little bit of a human error there. And sometimes we don't put all of the clearance flags or study flags out over the radio for brevity reasons. We clear over the primary channel, and we like to keep that as clear as possible for emergency traffic. So again, it's going to be reduced. So what are we seeing? Anecdotal evidence. Yes, I think that there are mental health calls are on the rise. We are seeing more individuals that are experiencing some sort of mental health issue than we have in years past. I've been with the agency almost 20 years, full time now, and it's definitely significantly more than what it was in years past. There's also a lot of coupled issues, such as the substance abuse. We see a lot of folks that are dual diagnosis. So they may have a mental health issue, but then coupled with either drug abuse or alcohol abuse, it tends to exacerbate those issues. And it's more common to see that, I think, nowadays than before. We do experience some folks that are just service resistant as well. Part of it is because they don't want to talk to the police. But even if we try and set them up with one of our community partners, so it's not involving law enforcement, some people just don't want to do anything about it. And a lot of people, or our community, has a hard time understanding the fact that maybe somebody that's not behaving in a way that we would consider, quote, normal, isn't against the law. They have to be doing something that violates a law, or they have to be at a point where they're either a danger to themselves, a danger to others, or unable to care for themselves. And being able to not be able to care for themselves or be gravely disabled is actually a very high threshold to meet. So somebody that may be walking around talking to themselves, but yet can interact with you and has a means of feeding themselves and has some sort of plan for what they're doing for housing, whether it's something that we would think is sufficient or not, doesn't meet gravely disabled. So there's those individuals that I think it's, again, just with our staffing shortages, that we just have a hard time reaching right now. And there's other challenges that tend to deal with timing. We may have an individual that was service resistant, who is no longer service resistant, and they want to engage in the process. But at that time, we may not have services to offer them. We can't get a clinician to them, or there's no beds at PATH, or we don't have anything available through Good Sam or tiny homes. So there's always timing challenges that we try and work through as best as we possibly can. And that's what I have. Any questions?
Yeah, I have a question. I wanted to
Yes.
ask about the law enforcement jurisdiction for the La Posada project. Is that going to be Santa Barbara Police Department, or is that going to be Sheriff's Department jurisdiction? And that's
La-
at that's where the old juvenile hall facility is, off of Halstead near the creek side.
Yes, that'll be the sheriff's office.
Okay.
Yes. So the Santa Barbara Sheriff's Office has 4 co-response teams, I believe, countywide right now. So they have deputies partnered with clinicians, but I think there's 2 in South County and 2 in North County right now. But I'd have to double check with Dr. Lee to get the exact numbers on that.
Okay, thank you.
Yes.
So how does the jurisdictions go between the sheriff's department and the city responding?
It's based on geography.
Okay.
Yeah.
And is the way to reach your team through 911, or is there another dedicated line to reach you?
Through 911, through dispatch, or we do have if you're in the city of Santa Barbara, I can give everybody the non-emergency number. I'll type it into the chat.
Thank you. Yeah.
For to reach dispatch on non-emergency situations.
Thanks, Sergeant Payne. That would be wonderful.
Yes.
Yeah, thank you so much, Sergeant Payne. And I think just validating what you said, I know Commander Katsapis couldn't be with us today, but he's shared anecdotally that he's finding at least a plurality, if not the majority, of the instances that his team is responding to are related to behavioral health.
Yes, it's a lot of the calls that we respond to, again, I think more so happen to be of individuals of dual diagnosis. There's a mental health issue, and unfortunately there's some sort of an addiction issue coupled with that.
Landon, this is Chief Gordon. I just want to take a moment to acknowledge Sergeant Payne, the time that he put to provide this presentation, but just the overall work that the team is doing right now, and really elevating how we are partnering and the work that they're doing with SBAC and all of our different partners. I did have a conversation with Dr. Navarro last week, and we are diligently working that I haven't even had a chance to share with Sergeant Payne on trying to get a second co-response unit. And I know they are very much wanting to partner with us to do that, and trying to find a way to find a clinician. So we moved it a very positive step forward after my meeting with her last week. Just saw that I have a follow-up email with her today as well. So I'm hoping that in the next amount of time, we'll have a second co-response team. But like I said, I know the team is evolving, we're evolving. You know, law enforcement is not, the only answer. It's just one portion of it, and the partnerships. But like he, mentioned, we are often the first because of how calls come in and what the community sees and experiences. So we're very committed to the de-escalation piece, how we treat people, and how we, negotiate and navigate through services, because it is, as all of you on this call know, very nuanced. And when someone finally says yes, there's got to be a resource there available. Otherwise, all of the hard work that we've been doing to establish those relationships instantly melts away in a very quick second if we don't have them. So not just this team, but I can tell you, especially the day watch officers that are often the ones that interact the most, all know a majority, I would say probably 90% of our unsheltered population. They know these individuals by name, and really try to interact with everyone individually. So I just want to, like I said, point that out to the work that everyone's doing, to everyone on this call, to all of the different partners on this call. We could certainly not do what we're doing without everyone's partnership, and we are committed to just continuing to improve that partnership. So.
Thank you, Chief Gordon. And we do really appreciate all the ways that you're advocating for these resources.
And Landon, I know we don't have time to discuss it further today, but I think this cross-section of PD and behavioral wellness and other behavioral health providers, I think the link that's missing is access or knowledge if the individual has a case manager that's already been designated and already is engaged. And in an ideal world, you know, when there's an interaction, we would be able to note that with the case manager, or case manager would be able to respond, and instead of PD, or, you know, at some level of kind of really specific coordination and collaboration with that individual. So, you know, law enforcement doesn't have access to HMIS, and what are the pathways that we can do better in that regard? And especially too, when we have certain thresholds that need to be met for referral, like a danger to themselves and to others, but we don't want law enforcement in terms of arrest to be what meets that threshold, right? We want to avoid that as much as possible. So just a couple of things that I think have come up in our collaborative conversations that I just want to make sure that we're noting for future kind of behavioral health oriented conversations moving forward.
Yeah, absolutely. And thank you for naming that as one of the biggest challenges we have with this.